Hey guys, welcome back to the Impetus Health Podcast. Making sure the blue lights are on. The blue lights are on. That means we're live. So we are here again, joined by Dr. Chris Temples with Vulcan Performance. Chris, how you doing, man?
Doing great. It's good to be here.
Awesome. So today we're going to dive into a very hot topic but dry needling. Is it good? Is it not good? Is it worth your time? Is it not worth your time? Chris is going to answer a lot of those questions for us because it is a super hot topic. But now I would say as a PT, I would say every other, if not 1 out of every 3 patients ask me if they should be needled or not. So hopefully we can get some insight onto those of you who are thinking about getting needled, or maybe you have a hatred for needling. Who knows? Maybe Chris can answer some questions. So Chris, we're going to start off very quickly with a very general question. And I'll give some background too. But Chris, I know his background. I know how he's viewed things. We have an episode of Chris talking a lot about his strength conditioning and fitness background. And typically us strength conditioning guys, at least several years ago, we weren't necessarily thrilled with dry needling because I remember for myself, I kept hearing, okay, I'm going to put a needle in this. It's going to shut down the muscle. It's going to inhibit the muscle's ability to fire. So I want to ask Chris the question, as a strength conditioning guy, what changed your mind about dry needling? How were you convinced that dry needling could be helpful?
Honestly, biggest one, personal experience. I've had a handful of different injuries throughout my both athletic and weightlifting career. One that I remember the most, I was like, wait, this is kind of cool. I was still interning in undergrad, and I had some, my IT band was pretty lit up. I was having some, which was causing some knee pain.
I remember you telling me about this.
I had some, on fire knee pain. It was bad. And then I was interning at a physical therapy clinic, and I just mentioned it to the PT I was following that day, and they're like, "Oh, hey, yeah, just stick around after hours, and I'll try to needle it for you." And I was like, "Is that actually going to help?" And they're like, "Yes." I was like, "Well, kind of why?" I wasn't very familiar with it, but I was like, "How's a needle going to being stuck into the side of my leg help my knee pain?" But lo and behold, sat down, had a session of that. Knee pain immediately went away. We did some retest before and after, and an air squat hurt prior. Air squat felt great afterwards. Loaded it up, still felt great. So obviously something changed.
Yeah.
And I was like, this might be beneficial for people.
Yeah.
So that was kind of my very first wait, this might work.
I love that. So what do you think's going on? Why does it work?
Honestly, the research is varied on why it works. There's a handful of different thought processes on that, on why dry needling works and who it works for. But what we do know is that there can be a physical mechanical change. The most common one that most people probably have heard of is trigger points. You've got that spot on the back of your neck right now. You put your hands on it, you might have a little bit of referred pain or it doesn't feel too great. That's called a trigger point. One of the theories that I've read about recently is that this is caused from an overactivation of that muscle, which leads to a lack of oxygen, causes the muscle to potentially be contracted in a state where, like I said, it's balled up basically.
Almost like it's vasoconstricted and you can't get blood flow. Okay.
Exactly.
Interesting.
Which is now painful because our muscles need blood flow to function. So one of the theories is, you take a needle, you drop it down into that muscle, and it's going to cause micro trauma in that area.
A wound. Yeah.
A wound. It's literally a wound. But then that's going to bring a rush of blood to that area, reoxygenate the muscle, or it relaxes, or it is no longer vasoconstricted and now has a blood flow supply.
Yeah.
I've had it done to myself. I've done it to other people. I've watched other people do it where, for example, a really common one, upper trap.
Yeah.
We know that one of the upper trap referral patterns can cause some headaches, like migraines out of this world. Well, there are certain muscles and locations that you can drop a needle down into a trigger point that you have to, obviously have to find them. If it's not there, then that's not the issue. But you can find those, drop a needle down into it, and most people typically respond pretty well to that. And have relief. Now, granted, I've told a lot of people that needling by itself isn't truly a fix because it doesn't address the why.
Yeah.
It just gives you a relief and it can last for quite some time. Like it's like a dry needling session by itself can last weeks to months. But if you don't address the root cause of why it happened in the first place, then you're at risk, obviously, to have it happen again. I mean, that's the current best research shows that a previous history of injury is the best indicator of potential future injury.
That's great. So it might be helpful if we did that, because I'm learning a lot too. So what would you, if let's do a compare and contrast. So what would be the worst application of dry needling versus what do we think is the best practice of dry needling? How would those two compare? Because how we do dry needling at the clinic, and you're kind of our go-to dry needling for this, we've set this up a lot through you, is, I'll let you explain it, but we have a specific way that we like to do it. We do it at a certain time before, all this different stuff. What would you consider like a bad way to needle, and what would you consider the best practice of needling? I want to tell you about our Vulcan run templates that we have in our Vulcan store. We have a 5K and a 10K template, and it's basically how can I PR my 5K or 10K without injury. We use two of the best tools that you can use to prevent injury and also to see if you're getting better or not. We use the 10% rule, which, as we've talked about on some of our episodes, any 10% increase or decrease in volume or intensity increases your odds of injury by about 72%. These templates take that into account. Also, we have the acute chronic workload ratio worked into the template, and that ensures that the program that you're doing is going to either get you better and also prevent injury. They're really high-tech stuff, but as you're going through the templates, you're going to put your RPE scales in and some other factors, and that's going to let you know if you're in the right place or not. So if you want to do better on your next 5K or 10K, if you want to be a better runner, these templates are for you. They're really simple. The 5K template is a 10-week program, and the 10K is a 20-week program. So check those out online at our Vulcan store, and figure out your next run. See you guys.
Well, I mean, kind of with any sort of therapeutic intervention, the worst way to needle is one, needle someone that doesn't want to be needled. That's like number one. Like if we're going like worst case scenarios, like this is number one.
Let me chase you down.
If you don't want to be needled, like I'll bring it up one time. If you say I don't like needles, I don't want to be dry needled or anything like that, I'm really not going to push that button.
That's
at
good.
All because that's just not going to be beneficial for anyone.
Yeah.
We'll take a different route. There's always a different route.
Yeah.
There's never one singular answer. There's always different facets of that.
Yeah.
So obviously that's going to be the number one in that regards. But then different sorts of injuries respond differently to it. Like just because you have shoulder pain does not mean you need to be dry needled for it. Again, going back to like the trigger point methodology, that's kind of where most of my brain goes to whenever I think of who would benefit. If it's like, oh, hey, I can put my finger on the spot and that causes pain, either in that spot or it refers pain elsewhere. That's who I'm kind of looking for that.
Yeah. Localized area.
Yeah. There's other applications for it in terms of inflammation as well. I've seen and had very good results for, let's say, low back pain, especially if it's caused by something, deadlifts. I've have a couple people I've worked with in the past that they had a workout on Monday, went well, had tons of deadlifts, power cleans, anything with a lot of extension of the spine, and then wake up Tuesday morning and they're like, "Holy crap,
I'm blown up.
I can't move. I can't move at all.
I've been there.
I can't do it." And they've called me, and they'll come in for a session, and 30 minutes later, they're up and out, walking out the door, either pain-free or significantly better from, like, say, 8 out of 10 to, like, a 2.
Yeah.
Like, within 30 minutes. And that method that I use for that typically involves actually a form of electrical stimulation to those areas through the needles. And in my opinion, that is very different than just slapping, an NMES device on there, like a TENS unit, and just letting it run, because those clamps are attached to the needles, and the needle is inserted into the muscle. So it's not superficial. It's actually providing a current through the physical muscle itself.
Yeah.
And some research has shown that has been beneficial for decreasing of inflammation, as well as, again, decreasing that unwanted tone in those muscles, which then allows them to move through that full range of motion or more pain-free manner.
Yeah.
Again, that's not addressing why it happened in the first place.
Yeah.
So everyone I work with for that That's why you mentioned kind of like how we have it set up. Like our preferred method is if we have something going on that requires dry needling, that we hit a dry needling session and go directly into a treatment session.
Yeah.
So that way we can then use that newfound range of motion, decrease in pain, to then make a physical lasting change on that top of that.
Yeah. Yeah. I love that. And it's really interesting. I think dry needling has brought up a lot of different avenues in healthcare. So, for instance, a surgery that's becoming more popular is a surgery called a topaz surgery, and I've had to research this recently because I've had a patient getting into it recently. But
I'm not overly familiar with that.
yeah, and I wasn't either, so I had to look into it. But so the idea with what you talked about with dry needling with stem would be you're right. The needle is in muscle. There's a current going through the needle into the muscle, so there's more than just something in the muscle. There's something more going on. Well, this topaz surgery is they put needles into a tendon, and while it's there, they actually send sound waves through the needle, which is rather similar to electrical current, not the same, but similar. And it's pretty new, so the research is inconclusive right now. But like you said, through dry needling, you're seeing some really good anecdotal evidence through this, which is pretty cool. I think that idea might have stemmed from dry needling or some type of acupuncture branch off down the road. Because you're right, the little that I do know about dry needling, I know that the most effective version is when you throw some electrical current through it. I know that.
For sure.
And I like what you said, like you don't just needle. And that's kind of what I was thinking. You don't just needle, you try to do something afterward.
Correct.
Too. You try to follow it up with some type of contraction, whatever, use what you just bought.
Exactly.
Essentially.
Similar to, like different, muscle energy techniques or other manual therapy, like you use that to then create a change so you can then load it and have a change out of that.
Yeah.
Like I heard a quote the other day on a video, and it was, he said, "You didn't get hurt on this table. Being on this table isn't going to fix you. You've got to load it afterwards."
That's good. That's good.
Like, that's cash.
I like that. When would you not want to be needled? So like, I don't even know, like maybe for an athlete or something like that, when are bad times to be needled?
If you're sick.
If you're sick, yeah.
As if you have any sort of disease state. I mean, I'm sure someone out there is comfortable with that or has done some research showing that it may or may not be beneficial in that state. But if you're sick, I really don't want to be messing with any version of your blood at that time.
Yeah.
But honestly, I've seen good results right before a workout. I've seen actually good results pretty close after a workout.
Okay.
But I will say what I haven't seen yet, which again, I haven't been doing this as long as some people have, so I'm sure some people have seen other things.
Yeah.
But honestly, as long as it's not an overly aggressive session, like let's take somebody, say they've got really bad glute issues going on, and we're in there for 30, 45 minutes trying to really get them to loosen up. We're getting responses with everything. Like we're not wasting time, but we're actually working for like 30, 45 minutes straight. I mean, you're going to feel like you just finished a workout because every time that needle hits and you get a muscle contraction, I mean, that's a full effort contraction.
Yeah.
So
walk somebody through that if you don't mind. Like, because I mean, a lot of people might be thinking, okay, a needling session is I'm getting one needle and it's going, like, what does a needling session look like?
So again, depends on the person.
Yeah.
I hate to use that answer, but it really does depend. Let's think back on, let's use that deadlift example that I got. Guy I've been working with, his sessions typically look like, comes in, say session's at 3 o'clock, he comes in, we drop, for him it's about 12 needles into his lumbar spine.
Wow.
Targeting his multifidi and his paraspinals.
Yeah.
And then we hook those up to 6 different leads for electrical stimulation. And then we stimulate that for 15 minutes and then go into it after that.
Wow. Okay. Yeah. That probably is not what people typically think of dry needling. That's cool.
So again, that's more of the electrical stimulation aspect.
Yeah.
If we circle back around and go raw trigger points, like, hey, there's this one spot, I literally just squatted down, I've got this spot. This is if I get this to release, then that would be a situation where it's okay. Let's drop one needle in this, pop it in there, pop it out. Realistically, you'll have some relief after that.
Yeah.
So there are different methods to the madness, I guess.
Okay. I don't want to get too far into this. If you could keep it more in layman's terms, but
Sure.
what is some of the evidence in the research indicating about dry needling?
So the most recent research that I've read is that dry needling, on average, for the average individual, can be beneficial. It is more beneficial than not doing anything.
Yeah.
But in terms of coupled with other things, the best results with dry needling is whenever it is coupled with therapeutic interventions such as exercise.
So not left alone.
Not left alone. So like your best results are going to be needling plus exercise.
Gotcha.
You can get results with needling alone, but it's not going to be the same lasting results, and it's typically going to be more of a short-term relief.
Yeah. I like that. That's good. Kind of a general rule for thumb for me, at least when I think about it, is something, because there are all sorts of tools and fad tools and all this stuff out there. I always try to think, is it creating blood flow? If yes, then that's a good sign. Is it creating a contraction? Then yes, that's also a good sign. So I look for those two. With needling, I think you're right. If you left it alone, if you just needled and that was it, then you're going to create blood flow. You're going to create a wound, but it could be inhibiting the muscle. But on the flip side, potentially. But on the flip side, if you needle, and especially if you're doing stem's going to create a big contraction.
Creates a contraction.
You're getting both of them. But then all of a sudden you're going into a session afterward where you're using that area, you're firing up that area. You get, I could see the coupled events. You're getting all the benefits of it without any of the negatives.
Correct.
Which is awesome. Okay. Okay, some interesting questions. Sometimes we see some pretty strong dudes. We see some pretty strong guys who are lifting weight.
Sure.
Is it easier to needle someone who is smaller or someone who is just jacked? This may not even be an answer you can give me.
Honestly, I would say that actually depends on the muscle. Which muscle is it?
Upper trap. We'll go upper trap.
I'd rather have big thick dude.
Yeah, big old trap you can grab onto.
Give me Schwarzenegger. Glutes. Give me Miss Betty.
So big glutes are hard.
Big glutes are hard because they're huge. They're massive. Like I personally, the biggest needle I've got is 110 millimeters. But you get a bodybuilder in here with, for lack of a better term, a dump truck on them. That needle's not going to hit the muscle we want it to hit.
Yeah.
It physically will not reach there because they are well blessed and have put in the effort and they've got too much muscle.
Yeah.
So that for them, either A, I'd have to get a bigger needle, or two, find a different intervention that works for them.
Yeah, I like that.
So it depends.
That's good. Okay. Let me ask you this, and we'll wrap up after this. For people who are thinking about being needled, what do you think are some questions that they should ask, or what's some advice that you could give them?
Well, first question you should ask anyone before you get your needle is, have you done this before?
That's really good, yeah.
Second, I would ask are you certified?
Okay,
because there are certain states that do not require certification for dry needling. It is something that you just say it's not covered in the Practice Act. So I would, even if that state does not require that, in my opinion, you should at a minimum be dry needled by someone that has a background in that before. Like, you don't want to be someone's guinea pig for a dry needle session.
For sure.
While there are very minimal risks, you could still potentially hit a structure that you don't want to hit and have some uncomfortable feelings after that. So that would be like the very first initial questions I would make sure you ask.
Good. Yeah. So I guess on that one, on the risk side, because you can puncture a lung, right? Is that
you can? You would have to be, and I say stupid to do it, but like as doctors of physical therapy, like we are anatomy experts.
Yeah.
You know where the lungs are. Like if you are.
I'm going to edit this out. I might ask you that question again.
I'm not going to be able to do that because I have a meeting scheduled now that I can't miss, and I don't think he had any other days available or hours available that day. So just give me a call back when you get this. This is Friday about 1:45, and you can wait until Monday, but I just wanted to let you know that I won't be able to be there at 10 on Monday. Thanks. 205-907-5706. Bye.
Okay.
Appreciate the phone call.
Yeah. Now maybe restate the question. I think I can ask it a little bit better.
Okay.
So there are risks involved with dry needling. Like So it's a whole nother reason why you should want somebody who's done it before, who know what they're doing, because you can have a significant risk like puncturing a lung potentially.
Sure.
Can you go into that a little bit?
Yeah, I mean, obviously, like as physical therapists, we are masters of anatomy, and like we know where the lung field is.
Yeah.
But if you take the wrong approach, use the wrong needle size, or especially like working with a smaller individual, like there is a risk for that. But again, that's why you want to go to someone that has a certification or has been trained by someone else in dry needling.
Yeah.
Because then in those classes, like they are taught, like, hey, these are the angles we can go. These are the safe places. These are the ways you can get to those muscles and be perfectly fine. Like obviously, there's not a muscle in the dead center of your lungs. We're not going there anyways. But there are muscles that kind of go around it, like say thoracic paraspinal muscles. Like there's a time and place where we might need to get in there. But that is a time where you have to be aware and be like, okay, how big is this individual? Are they smaller? Are they larger? Okay, so now that's going to dictate the needle size I'm going to use. And then also, you have to be aware of the orientation of the needle. And whenever you put it in, you just have to be cognizant of, hey, I'm going here. What structures are here? Okay, this is the muscle I want to go to. I know I'm in the right place. We're good to go. We're locked in. Or you take let's go with the novice, never done it before. It's like, oh, let me do this.
Yeah.
And he grabs a way too big of a needle, isn't aware of the structure, and drops it in the wrong place. You could potentially have an injury from that.
Yeah. Yeah. Okay. So correct me if my summary is wrong when I'm going to summarize. Needling could potentially be good, especially when it's coupled with other therapeutic interventions and the person actually wants to be needled.
That's a very true statement.
Okay, great. That was good. Is there any other final thoughts you have on needling?
I mean, final thoughts on needling is if it is interesting to you, or you are like, I wonder if this would help, reach out. We can do an evaluation. We can tell you if it would or not be beneficial for you.
Yeah.
Like I said, I have a decent amount of experience now doing this, and I've found that certain injuries respond better than others, and I might be able to tell you that, oh, hey, yeah, let's get you in. Let's go after it. Or it might be like, hey, that's not the route we need to take.
Yeah.
But again, that is on a very individualized basis. So reach out, and we'll make a plan.
Yeah. I love it, especially if you have something localized. I can kind of pin in your head for that. But awesome. Well, thank you, Chris. This was good. I actually learned a ton. I don't know much about needling. I feel like I know more now. So appreciate it, man. Awesome. Well, guys, y'all take it easy, and we'll see you next time on Impetus Health.